A good example of this is shoulder instability. We do see a lot of patients having shoulder dislocations, but it really depends on the individual as to what the optimal treatment pathway will be. The shoulder is an inherently unstable joint, so the stability is compromised both of the patient's individual anatomy, and everyone has different shaped bones, different shaped muscles and tendons. It's also the strength of the rotator cuff is very important in maintaining shoulder stability, but then also the individual patient's ligamentous laxity. So we do see some patients who are double jointed, for example, where they're at much higher risk of having ongoing instability than patients with normal ligamentous laxity. So a good example of this is within the last 6 months, I've seen 2 patients, both teenage boys. Both of them had first-time shoulder dislocations playing football. One of the patients came to see me fairly quickly actually after his injury, and his shoulder was actually dislocating in multiple directions with very minimal effort. So he gave me an example of being on the train and the train jolted to a stop and he felt his shoulder pop out without even having any force applied to his shoulder at all. When I examined him, as soon as he moved his arm up, his shoulder was popping out in, as I said, multiple directions. Now this patient, I spoke to him and I said, you know, look, I'm concerned that if I do an operation straight away on you, that your shoulder is going to be so unstable with your pattern of muscle weakness, and he did have some underlying ligamentous laxity, that we're going to be in a situation where you might be at risk of redislocating very quickly after the surgery, and then we'll be having to go back in again. So instead I sent him off for some physiotherapy to retrain his rotator cuff muscles, to strengthen up all those other stabilizers around the shoulder before we did his surgery, and that worked really well for him. When I actually got to doing his surgery, he was only really dislocating when I was putting his shoulder in the high risk positions. On the other hand, I had this other patient who came and saw me who, as I said, first time shoulder dislocation as well, playing football. Now he had also had some instability episodes between the initial dislocation and when he came to see me, but his were all in the context of putting his shoulder in different positions or in, actually having stress applied to his shoulder. So for example, he reached behind his back and felt his shoulder start to pop out. And this was a situation where I spoke to them and said, given his age and the fact that he's playing football, he's at high risk of having recurrent dislocations. And for him, I felt comfortable that we could go straight for a surgical option without having to do the physiotherapy first, and that he could then do physiotherapy later on to work on those other factors, as I said, with the muscle strength. And I think this was just a good example of 2 patients where, as I said, they had very similar injuries, but when I saw them, they had different presentations and different factors which influenced how we were going to treat them and what pathway we were going to go on. I think it is really important to get those opinions, to be assessed, to have those scans. There are some patients that have a first-time shoulder dislocation that, certainly I'm very happy to send them to physiotherapy and try and avoid surgery. But there's also going to be some high-risk patients where, as I said, if they're going to go back to playing football, and especially in that teenage age group, where I do have to have a discussion about the risk that they have further dislocations and potentially cause other injuries at the same time. A lot of the time it will come down to what the patient's preferences are and what's important to them, what their activities and hobbies are. But yeah, I think, if you can get that information early, then it just means that patients feel like they can make that informed decision straight away. Absolutely. I mean, we've got a team of specialists here ranging from all different parts of the body, and that's something that patients are able to access through Skin+Bone Clinic.